Is marijuana or cannabis a medicine? Cannabis is pharmacologically active as a plant, and there are 2 FDA-approved medications that are single constituents of cannabis and one that is a combination of 2 cannabis constituents that should be approved soon. These medications have not been as effective as consuming specific strains of the actual cannabis plant that are claimed to have similar target effects. The argument has been made that the combination of over 60 constituent chemicals is necessary for a maximal therapeutic effect. My opinion is that smoking a joint or taking a bong hit has a greater placebo effect than swallowing a small white pill. This would mean that the actual therapeutic effect of cannabis is less than proponents would like to claim. But it would also mean that there's a strong placebo effect when you do the behavior of smoking a joint. We should use that, not gripe about it, in order to affect all treatments. Cannabis reduces intraocular pressure, for example, in the eye. It lowers fasting insulin levels, it makes carbohydrate metabolism more efficient, it increases appetite, reduces nausea, reduces neuropathic pain, reduces muscle spasticity, seemingly cures intractable seizures in the rare childhood epileptic disorder called Dravet syndrome, and it may kill certain types of cancer cells and may improve certain types of immune function. The problem is that other drugs are easier to dose and maintain 24-hour blood levels without long-term side effects, and come in forms that have a more predictable onset and potency. Now, Dravet syndrome may be an exception, but cannabis is not a first-line treatment for anything, and in most cases, not even a second-line treatment. Are you getting the idea that cannabis is sort of like snake oil? I mean, in a good way. It has real pharmacologic effects that are less than ideal for a specific small number of conditions, and its claims are exaggerated. But due to its high potency as a placebo, may have real therapeutic effects for another small range of specific symptoms through the placebo effect, and these symptoms affect large numbers of people. Does that make any sense? Let me say it a different way. Cannabis reduces neuropathic pain, or pain due to neurologic injury, through real physiologically active mechanisms, but no better than other medications, and there are deleterious side effects that make it less than ideal as a treatment. In addition, due to the behavior of how it is consumed, its potency as a placebo is high, and we know that placebos are good at treating pain. Therefore, cannabis is not a great treatment for pain, but it is a great treatment for pain. Still confused? Well, I think that what we can really say about cannabis is that it can treat pain, nausea, and psychosomatic illness through its effect as a placebo, and probably also through real physiologic effect. It is a third-line treatment through real physiologic effects for glaucoma, diabetes, spasticity, poor appetite due to age and cancer chemotherapy. It may be the treatment of choice for Dravet syndrome. It can be addictive. It is harmful if used in chronic high doses. It has been understudied, and there may be additional real medical treatments that we have yet to discover. This section will highlight the unique place that cannabis occupies at the threshold between alternative and mainstream medicine.